Hi, everyone. I'm your host, Liza Tillman, and today we're talking about an important new program at Southwell, Maternal-Fetal Medicine, or MFM, which provides specialized care for women experiencing high-risk pregnancies. We're proud to partner with Women's Telehealth to bring this service to our region, and joining me today is Dr. Ann Patterson, lead physician and founder of Women's Telehealth. Let's get started. Thank you so much for joining us today, Dr. Patterson.
Well, thank you for having me.
Yeah, we're really excited. So let's get started with our first question. How did this partnership between Women's Telehealth and Southwell come about, and what makes it unique?
Well, I've always wanted to be in Tifton because I have family here.
Okay.
And we reached out to the leadership at Southwell, and they were interested. And it was just the right leaders at the right time, Mr. Dorman, Julie Williams, and we're very interested and open, and we came to visit and demonstrate what we could do, and it grew from there.
Tell us a little bit about Women's Telehealth.
It is a maternal-fetal medicine service that was founded almost 14 years ago.
Okay.
So we've been doing this a long time. We've seen about 200,000 patients this way.
Wow.
And our practice is entirely by telemedicine.
Okay.
We are able to see the images of a fetus real time, just like we were scanning and standing at bedside. We are very enabled. We can put a stethoscope on mom's chest. I can put it in my ears and I can hear her heart just like I was at bedside. We look at images that are store and forward. We do a consult on the patient. So any problem that a patient has that would be seen by a maternal-fetal medicine specialist, we can pretty much handle.
Okay.
Unless we have to do something invasive.
Yeah. So just so everybody knows, your company is based out of Atlanta. Is that correct?
That is the home office,
And
yes.
then you guys see patients all across the country.
We are licensed in 20 states.
Wow. So it's not just here in Tifton. So you guys
Correct.
are busy all the time.
Yes.
Yeah. So kind of touching on that, let's walk through what a typical patient experience looks like in the MFM program from referral to consult. And I know, and you touched on telemedicine earlier, but it's kind of still a foreign concept to us. We understand what a virtual visit looks like, but how does that work for a high-risk patient?
So there will be a referral to our service. She is appointed. The patient knows when to come. She comes to the MFM office, maternal-fetal medicine office at Southwell, and she is checked in. The nurse has already pre-evaluated the notes that have been sent across or the referrals. An MA has looked at them, and the chart has been populated with the information and the concerns for that patient. She does get a patient interview. Vital signs are taken. The chart is updated. The patient then goes into ultrasound. The sonographer images the fetus, or more than one, whichever. And if there's any concern, we can actually see the images live with the sonographer and the patient. Typically, that's done if there's some kind of concern for some reason, or we need to show the patient something specific. Otherwise, the images are sent to us in a store and forward manner. We see them pretty fast. Once those are evaluated and we've looked at the records and the chart, then the patient has a consult. She typically is taken to the consult room where a telehealth presenter is there with her, and if she has a support person, they are in the room as well. And we go over the scan. We go over any issues that she has, any medication she's on, changes in medication, concerns, other consults that are needed. We go over everything that we need to talk about with the patient. She has the opportunity, as well as her support person, to ask questions. If there's a concern immediately, we'll often have spoken with the referring provider, and she is aware of that.
Okay.
And then we make plans.
And just go from there. So that's really what you'd expect at the first visit. And
Correct.
One thing I really want people to understand is that you are not replacing someone's primary OBGYN provider.
Oh, no. We are typically there as a consultant to the obstetrician or nurse midwife, and they are the ones that are the primary care for that patient. And so we are in addition to, but not instead of.
And the wonderful thing is that, and we'll touch on this a little bit later, but previously these services were not offered in Tifton.
Correct.
Patients had to drive to Albany, to Macon, to anywhere else that would offer that. And that is a hard journey on a high-risk pregnant mother, let alone a pregnant mother. So tell us a little bit about what difference does that make for women?
Well, I think it does make a huge difference, particularly for women who are either very anxious and having to travel a distance and with anxiety for starters.
Yeah.
But there are also ladies who really don't have the ability to travel that distance, and so they wouldn't get this kind of care.
Yeah.
And the intent of Women's Telehealth when we founded it was to bring high-risk maternal-fetal care to places that would otherwise not have it, and that was the goal. And that's one of the things that's so exciting is that women who would otherwise never be able to have this can.
Yeah. Right here in Tifton at Tiff Regional Medical Center.
Correct.
They don't have to go far. And just, especially if you see one of our providers who are in this area, in this immediate around the hospital, you just have to drive over. We were talking about that earlier. You just said that you're not going to have to deal with all the massive parking issues that you might if you had to go to a bigger facility, and you're most likely going to be comfortable driving in this area and knowing where to go. So, yeah. How do you and your staff and Southwell staff work together to create a seamless experience for patients? And that's why I asked you earlier about if, you're not replacing someone's primary OBGYN, and maybe somebody's nervous about this random doctor doesn't know me and they're going to come in and do all this kind of stuff, and then they're never going to talk to my doctor, and you just have these anxieties. So how does your team work with our team?
So this morning, one of the referral coordinators said to us, and it was I think answers this really well, that we are the easiest office she's ever referred to.
That says a
we
lot.
have the easiest and quickest response to getting a patient in, and it's the easiest and most succinct reporting she's ever had. So I thought that was really very good. But we do try to coordinate all of that, both from the Southwell team and from our office, to make sure that happens. And in addition, we do have weekly meetings to make sure that we are all on the same page and that all of the systems are working as they should. And if they're not, what's not, and how to correct that. So we try very hard to make it as easy and as seamless, not only for the patient, but for the provider that's going to be given the care.
Yeah. So, and you've had patients, we've heard feedback from patients saying that they've really enjoyed working with you guys.
That is what I've heard. We've also had a really kind of unique experience. We had a lady who didn't really want to be here.
Okay.
She was over 40. She had advanced maternal age. She had hypertension. She had type 2 diabetes. She had obesity and a small baby, what we call growth restricted. And so she had to come see us frequently. And she had testing twice a week. And over time, she got very compliant with her diabetes. She took her blood pressure medicine. We got the baby growing. And when she delivered, which was near term, she asked if she could take the baby back downstairs so she could be on camera and send an image so we could all see her baby. And that's amazing. The kind of heartwarming things that just make your practice truthfully.
Absolutely. Well, and we've talked about this, but this is it's anxiety inducing to be pregnant no matter how many times you've been pregnant, but then to be told you're high risk. And maybe not wanting to come to terms with that and saying, no, I've got this, I'm good, I don't need your help. It's so nice to know that we have a service now that our providers trust. Clearly, they are very particular about who their patients see, and that they can trust you guys to work together on that. I think that's huge. And speaking of that, you touched on this with that other patient, but what is considered a high risk pregnancy? What benefits most from this telehealth model, but what is a high-risk pregnancy?
Well, there are many things that can make a patient high-risk. Typically, what we'll see a lot of are hypertension, diabetes, obesity, advanced maternal age, exposure to different medications. Those are the typical ones we will often see.
Okay.
But any type of problem with the baby, any type of problem that mom can have is what we're trained to take care of.
Yeah.
And we literally can do 97% of all maternal-fetal medicine this way. And if you come, we certainly can't do an amniocentesis. We can't do fetal surgery. But we do have relationships with appropriate places, and we will see that you get taken care of at the right place for whatever that concern is. And we follow up to make sure that gets done. And our team has done this in a lot of different venues, a lot of different places. So there are a lot of resources that we have.
Yeah. And touch on, I think you talked about this earlier, but the live scanning. What I think when I heard live scanning, I thought, well, yes, you're in person, you're scanning me. What does that mean to you, and what does that mean to the patient?
So when the patient is in an ultrasound room and the sonographer is taking the images, if there's a concern, what she can do is notify us, and through a different pathway, we can actually come on and watch the scan while it's being done. And the patient will actually see us, but we will be seeing the ultrasound images. And we can talk to the sonographer. We can guide them as to, say we're doing a fetal echo, about what image we need or how to change the probe or whatever is needed to obtain the images that are important.
How amazing is that for a mom who is anxious to be able to be talking to her doctor instead of having to look at the screen that she has no idea what she's looking at?
Well, and if we need to, we will show her.
Sure.
If there's some concern that we want our patients to understand what's going on.
Yeah. Yeah. I just can imagine that's an amazing gift to be able to have that opportunity. And when you go to a brick and mortar office, that's generally not going to happen. I would imagine.
Well, it can.
It can.
Depends on the location and situation, but it doesn't always.
Usually you're coming in for the ultrasound first, and then the doctor's coming and talking to you. And so to be able to have that live scanning is just, that's huge. And to have that, again, to have it in Tifton, it's amazing. And again, we touched on this earlier, but how do you think that this program's helped our patients in South Georgia who might otherwise have had access to limited MFM care?
I think we have been able to reach people who otherwise might not have ever had it. Yeah. Women who might not have had the ability to even drive across the county, much less drive 2 hours away or an hour and a half to 2.5 hours away to get this kind of care. And I think we have made a difference in their lives. And that's the goal.
When we were talking about this earlier, do you find that patients have a hesitation that it's going to feel kind of cold, like we're not going to have this relationship with each other because it's telemedicine? Tell me what's the difference that you guys bring to the table?
One of the things that is very important to me is that we are personable when we talk to the patient. That's very key.
Yeah.
And of course I think that's important in person as well, but you have to be really careful as you have other physicians who've joined us that they too are able to, communicate and are comfortable and are able to get patient engagement. That's very important.
Yeah.
On the other hand, in this generation of young women, they've grown up with technology.
It's true.
And it's not so foreign to them.
That's true.
And it's very rare. I'm not going to say it hasn't ever happened, but it's very rare that you see someone look like deer in headlights. Oh my, what is this?
Yeah.
It's very rare. And we do satisfaction surveys. And so not just for Tifton, but everywhere.
Yeah.
And we get somewhere around 99% satisfaction. Yeah. So, and obviously we still monitor that, but that's important.
Well, and I'm sure our physicians are doing a good job of kind of preparing you what that visit looks like. Don't you guys reach out to the patient directly and tell them to where they need to park and all that? How does that process work?
So once the referral is sent, then the patient is contacted. When the appointment is made, they are given general instructions about what they're going to, where they're to go, what they're going to see, how it's going to unfold.
Yeah. That makes a difference too. So you're not walking in blindly,
correct,
not knowing what you're going to do.
Yeah, that would not be good. So we try to make sure that they have a good understanding of their visit.
And can they bring somebody with them to this?
Absolutely.
Visits? Okay. I know our rooms are a little small, but you'll make room for a support person.
We try to have a support person there. I think that's always good.
And like we were talking about earlier, there's going to be the ultrasonographer. And then when you mentioned for a consult, or if they were somebody who would come back, there's going to be a telehealth presenter.
There's always a telehealth presenter in the room.
Okay.
Not only is that wise and helpful, it is a state law.
Okay. So we're following the law.
Somebody is going to be there as well. And, if we need to have labs drawn, if the patient needs other support and there's not a support person there, that's what that a telehealth presenter is there for.
So you're not just left in a room alone having a FaceTime conversation with somebody, right?
Never.
That's right.
And also, I should say, while it can look like just a FaceTime presentation, it is a bidirectional, HIPAA-compliant, medically encrypted network.
Yeah. Yes.
So it is very secure.
Good. Yeah. I think we have all, especially with the pandemic, we've all kind of gotten used to the idea, like you said, that virtual visits they're acceptable and and they're maybe not exactly as close to the same thing, but how does the real-time ultrasound and telemedicine elevate the quality of care compared to traditional models, would you say?
Well, I think the important part is that it brings care to people who otherwise would never have this kind of care.
Yep. Yeah.
And that's very good.
I said it was a simple concept when I was talking to you earlier. It's just the concept itself is simple. The technology is not by any means.
No, the technology itself is to perform telemedicine on this level is very sophisticated. It's far more sophisticated than just a Zoom call or your cell phone.
Yes.
And we want to keep it that way because that way it is medically encrypted. Mm-hmm. That way it's always very safe and secure information, but you also get the highest quality of care.
That's wonderful. So I know when moms come to find out that they have to have MFM, that they're high-risk pregnancy, probably the first thought is, where am I going to deliver my baby? How do you work with the primary care OB to decide that? And do moms usually deliver here? Do they have to go somewhere else?
Most of the time, mom is here, and the goal is to keep people locally.
Yeah.
And anything that we see that we think is very concerning, we're going to call the OB or the nurse midwife that's providing the care right away and work with them and work out a plan so when we talk to the patient, they know it as well. Okay. But by and large, we've been able to keep almost everybody here, which is the goal.
That's great. Because, I think it's just these conceptions that we have that I'm going to have to go somewhere and I'm not going to be with my doctor and I'm not going to be with the people, which, again, could be possible, but...
That's always possible, but the goal is to always keep people locally.
So if a mom has a condition that requires her to need antepartum care at the hospital here in Tifton, is that something that we can offer, and do our doctors work with you during that time?
Absolutely. So say somebody comes in and does have gestational hypertension or preeclampsia syndrome. They're not in a severe state. They don't need to be delivered immediately. Yes, they can be on antepartum. We typically do twice weekly testing. The physician or nurse midwife that's taking care of that patient sees them daily, and we work as a team to get this patient as close to term as we can, and then have baby delivered.
Okay. So we can do that here in Tifton.
You can do that here in Tifton.
I think people think that you're going to have to go, if you've got to stay in the hospital for a long period of time, you'd have to go somewhere else, but you don't.
They have a nice antepartum unit, works just fine, and we work with all the nurses there, so pretty seamless.
Wonderful. So since the launch in January, that's how long we've been doing this.
Correct.
What early outcomes or successes have you seen with your patients?
Well, I think we've had really good outcomes. We've been able to keep patients pregnant longer. We've been able to keep them here. So to me, those are all wins. And certainly the lady who didn't want to be high risk and didn't want to deal with any of her problems, but did. Yeah. And the outcome and wanted to share with us was just heartwarming. Yeah. I think the good news is when we started in January, the first month, I think we saw 37 patients. We've now done over 950 patient encounters.
That's amazing.
And that's exciting.
That is amazing. And you don't necessarily have to be a patient of, like, say, Dr. Price at Southwell Physicians for Women or anything. You can be a patient elsewhere outside of the Tifton community to come have these services.
And we have seen some of those patients.
Okay. Yeah.
And we do refer them back to their physician. We talk to their physicians, and we try wherever they're being delivered. The goal is to keep them there.
That's awesome. I think that's one of our biggest fears as pregnant moms is, where am I going to have this baby? So that's great to hear that that's what your goal is.
Locally is the goal.
Yeah. Wonderful. Well, to close us out, what message would you like to share with expectant mothers who may benefit from MFM services at Southwell? If somebody's kind of hesitant, what would you like to tell them?
That we are there to be their medical partner as well, and that we are there in conjunction with their OB provider to deliver the best care possible for both the mother and her baby, and to see that both have outstanding outcomes. And we take this on a patient-by-patient basis. This is very personal, because it's very personal to her and it is to us. And that's our whole goal.
Yeah. Well, that's wonderful. I'm just so thankful that you guys are here and that we have this partnership, and excited to spread the word to everybody, and appreciate you coming today.
Well, thank you. It's a pleasure to be here.
Yeah. To learn more about Southwell's maternal-fetal medicine program, visit mysouthwell.com/maternal-fetal-medicine. Thanks for listening, and we'll see you next time on Live Well with Southwell.